Hi, all my YouTube friends. It's Laurel coming to you from Ottawa, Canada. And I've had a really good week. Today is my week 7. So, 7 weeks from today, I had my surgery, RNY gastric bypass. And it's been a good week up until today, I suppose, but not because of my surgery or anything to do with me. So I weighed in this morning at 217 and a half, which brings my total weight loss. When I started my liquid diet, I was 260. So that brings a total down to 42 and a half pounds. And if I wanted to say from the day of surgery, it would be a total loss of 27 pounds even. So I don't know. The weight loss diet was part of shrinking the liver and getting my body in tune for surgery, so I'm going with that number. So I just don't want the people to think that 42 and a half pound loss in surgery. It does include the 3 weeks that I was doing liquid diet, so it's not as drastic as one might think it is. I had my checkup, my 6-week checkup with my surgeon's office, and everything was wonderful. My blood work all came back perfect. Everything was where it should be. I was a little bit concerned, have I been eating too much? Have I been eating enough? Have I been getting enough protein, fluids, so on and so forth? And everything checked out just great. And so I was told, just keep doing what you're doing. And so that was kind of nice. And excuse me, I have a frog in my throat. It was nice to have some good positive feedback on how things are going so far. Excuse me. I'm a little bit less tired this week than I was the week before. Could have just been sort of getting back into the swing of things with school and chores and stuff after being off, sort of being lazy over the holidays, I guess. So it could have been why I was tired, but I guess it's not abnormal to start feeling a little more tired than I had been. In terms of restrictions, I still wasn't really given the go-ahead to start skiing, which is kind of a bit of a bummer. So I missed a day of skiing with the family on Friday, and that was a bit of a drag, but it was recommended that I wait at least another couple more weeks, I guess just because I had that one incision that took so long to heal, that it was better to be safe than sorry. And so although I missed out on it, I have many more ski days that I can look forward to, provided that we get some more snow. And it's alpine skiing, so the risk is a little bit greater for trauma or blow to the mid-body, I guess, than it would be if you were cross-country skiing. So it was just recommended that I wait a little bit more before I get out there on the hills. Yeah, I did want to mention something. This has nothing to do with surgery. I don't know how many of you have watched my pre-surgery video. I think it was number 4, where I did a bit of a story about the last 23 years of my life, meeting my husband, going through fertility treatments, my son being diagnosed with autism and whatnot, and then with my breast cancer and losing my breasts and the chemo and the radiation and everything that I've been through. I had an appointment today with my son's specialist at the Children's Hospital, and it didn't go so great. And I'm going to try not to lose it and start crying. I just want to remind everybody to not take their kids' health for granted, because you just don't know how fragile it is. He hasn't been given a diagnosis yet, but he's not doing too good. He's lost almost 15 pounds since last March. And so for the last 6 months or so, we've been told, oh, it's just his meds. There was a change in his medications to help him deal with some of the symptoms of autism spectrum disorder. Don't worry about it. He'll catch up. He's just stalling. He'll have a huge growth spurt. Well, he keeps getting taller, but he doesn't get any heavier. And in fact, he lost quite a bit of weight. So today when we went to check in, he's severely underweight because he's grown another couple of inches. So now he's about 5'3" and he's about 78 pounds. He eats between 3,000 and 3,500 calories a day, and so they're not really sure what's going on. And I don't want anybody to, be alarmed by, oh, well, he needs to be eating this, he needs to be eating that. I mean, we've been tracking it. I've been working with both the pediatrician and the specialist at the Children's Hospital, and now they're going to start doing bone scans and ECGs. He's not allowed to participate in phys ed right now. He's not allowed to play hockey. Anything that could cause a blunt trauma to the body and cause a blow. And I didn't want to get into the details of all this, but I just wanted you to know that for those of you, the parents of my YouTube friends, that give your little ones an extra hug and a kiss. For me. Because you just don't know how fragile they really are. And or when something could go wrong, you can never prepare for those moments. And I try not to get worried about it, but it's hard not to, especially with his twin sister having been sick with Kawasaki disease. And I don't want to get into it. I just want you to hug your kids and remember how fragile they are and how precious they are and how special they are, given that they're so unique and different and so tremendously wonderful, and what joy they really bring to our lives. So my YouTube friends could do that for me. That'd be really nice. Keep you posted, and yeah, take care, everybody. Cheers. Talk to you next Monday.